Welcome to Speaking Holistically, the podcast that explores the power of alternative medicine, natural healing, and homeopathic solutions to help you achieve true wellness. Each week, Dr. Jen and Amy G dive into the world of holistic health, discussing researched, time-tested remedies with expert insights from Dr. Jen, as well as real-life stories from patients to empower you to take charge of your health. So if you're ready to embrace a more natural path to wellness, let's start speaking holistically, because true healing begins from within. Hi, everybody. Welcome to Speaking Holistically. I'm your co-host, Amy G. I'm here with my co-host, Dr. Jen. And this is our first episode. You're going to see how the sausage is made. We're just going to let this roll and have this conversation.
I'm not making any sausage or doing anything with sausage, so...
So I thought we talked about this episode. What we wanted it to be. Jen, your idea was to talk about how we met and my journey to holistic health and alternative medicine. Everybody's journey is different. I have a few pieces to my story. So we'll talk about first how we met. Somebody came into my life, a past relationship named Jay. So Jay, if you're watching, hi. And I've always believed, once the relationship ended, let me clarify. Once it ended, I understood that the whole purpose of Jay coming into my life wasn't the relationship itself. It was actually to lead me to you. I wholeheartedly believe that. You changed my life. I met you and I was never the same. And I have tons and tons of stories about my own health. And once you convinced me to take it into my own hands, basically how it changed my life and the life of my family too. I say I fangirl over you. You're a good friend. I still fangirl over you because I just think you're magical. So we met 26 years ago, which is insane. So we met through Jay. You guys were both going to go practice together,
Yeah,
right?
So Jay actually, his name's Dr. Jay Lashbrook, and I'm just going to plug him real quick. He actually works at The Joint in Murfreesboro, Tennessee now, and he's an incredible adjuster. Like, people have low back pain or some crazy stuff that other chiropractors can't figure out because
He's so good.
A bit different. He's excellent. So
yeah. He always has been, by the way. He was that way in chiropractic school. He was amazing as an adjuster, always.
Yep. So he actually went to high school with my brother, my younger brother, and we met and we both ended up starting chiropractic school at the same time. And I didn't know he was actually starting. So I'm going to back up a little bit. I'm a third generation chiropractor, clinical nutritionist, functional medicine, all that sort of stuff. My grandfather was a chiropractor and naturopath, graduated in 1951 from Los Angeles College of Chiropractic. And my parents are both chiropractors and do clinical nutrition. I was born when they were in chiropractic school. So I attended classes with them for the last 6 months of their education, the first 6 months of my life. And then I started working for them when I was 7, taking patients back, doing office work. At 8, I was doing chart notes and taking, patients back. And actually, they let me do chart notes at that point. Then at 10, I was developing x-rays. So by the time I got to chiropractic school, I already kind of knew who I was, what I was going to do, how I was going to handle things. And of course, I learned a whole lot through that whole process. But yes, Jay and I both started school. And Amy was dating him at the time, and we just hit it off. We both needed roommates, and we didn't have any roommates, and we didn't know each other. And then the craziest part, Amy, tell them the craziest part, we were both born in the same town.
Yes. One of my favorite facts about our friendship, yes.
Yeah, so that was super crazy. And so we're both pretty particular. We don't tend to call it anal retentive in our home, so we're both very particular. And so we did hit it off pretty well. And then this whole podcast just sort of organically happened on a phone call a couple months back where we're like, oh my gosh, we have to do this. This is going to be so much fun.
Yeah, absolutely. The fact that we were born in the same town, meeting each other is crazy to me because, it's because obviously you were in your mom's stomach when she was in chiropractic school. So I was shocked to meet you and find out we were from the same town because...
Town, not city. But town. So that's why it's so crazy.
Yeah.
So we ended up becoming roommates. And then we came from totally different backgrounds. I mean, I'd never had an antibiotic. I'd never had any kind of poisons in my body. My mom made homemade yogurt. I mean, we had well water growing up because we lived in a place where there was a well. And, so just completely different. And I didn't know. I thought everybody lived like I did. I thought everybody, had compost piles, and we went to the dump once a month to take whatever we needed to that was left over of what we couldn't utilize or whatever. And my parents, I wouldn't call them homesteaders, and I wouldn't call them crunchy granola either. They just, I don't know, it was just how we managed everything. And so, I was raised completely different. And so, yeah. So Amy gets an illness. Go ahead. Take it from there.
Yeah. So, I something happened one night. I had felt fine. And then all of a sudden I wasn't fine. And it was late at night. It was like 11 o'clock or midnight. And I started, like, my body started, I call it convulsing. And to be honest with you, I don't know how else to describe it. But basically my entire body just started shaking. My teeth were chattering so badly that I could barely get the words out to speak to you or Jay. And so I ended up in the hospital, in the ER, and they told me I had a severe kidney infection. I've never asked you this question, which I find really funny. I never asked what was that, because I've never had my body respond ever or behave in that manner ever in my life, before or since. And when I tell the story to people, I don't know what to call it because I don't know what it is.
So basically what happens is the body will actually start to shake like that because the muscles rapidly start contracting and releasing to create energy, to create heat, to warm the body up. So generally when there's an infection, the body, different viruses and bacteria are temperostatic. So they basically grow in a specific range. So let's say strep, which I grew in the microbiology lab with the rest of us, and we all ended up with strep throat, shockingly enough. But it grows at a temperature of about what the body is, so 98 degrees. It can be a little bit lower than that, but even a little bit higher than that, but that's about the range that it grows in, is about 98 and a half, 98 degrees. The body will try to increase the temperature by probably close to 2 degrees, 3 degrees to kill it off. So what happens is, to create heat, it will do that. It will start to rapidly contract and relax muscles to create a heat, to basically warm up the body to try to kill off whatever infection it is. We have lots and lots of checks and balances, and fevers are actually within range, actually a very, very healthy thing to have. Our body, wants to heat it up. If we have an infection that grows at 101, the body's going to try to, bring it up to 102, 102 and a half, 103 maybe. And then you're over it within a day or two. So that's basically what was going on, is that your body was trying to bring up the body temperature to try to kill it off, to bring it to a temperature that is hotter than where it can exist.
Okay. Thank you for that. So the doctor said, oh, you have a severe kidney infection. Here are 2 different medications I'm going to give you, 2 different, I don't know, antibiotic and something else. We got home from the hospital, and you called your parents, and then you got off the phone with them and you said, listen, I just talked to my parents. They're overnighting 4 supplements that you need to take to get rid of this infection. I will take this script to the pharmacy and I will get it filled for you against my better judgment. And you also said, this is the only time I've ever filled a prescription in my life. I remember you saying that. Yeah. Because
no, I literally had never been to a pharmacy. I had never filled a prescription. I was like, I'm not even sure what I'm supposed to do with this, but obviously I'm in my 20s. I can figure that out. So I went in there and just was like, I don't know how this works. Like, does the insurance pay for it? Do I pay for it? Like, I don't know what to do. And we had a friend, I had a friend that had traveled, and he was staying for a couple of days through town. And he was super upset with me. And he's like, you're such a hypocrite. You talk about healthy lifestyle and you're going to be a chiropractor, and you're going and filling this prescription for her. And I was like, she's literally cannot get out of bed. I'm not going to hold her hostage and be like, you can't do this. Like, this was pre, Amazon prescription sent to your doorstep. This was flip phone days of that. I don't even think we had flip phones. Actually, it was more like pager days, right?
Pagers.
Yeah. So I ended up at the pharmacy filling the prescription and bringing back for you, and told you, like, look, you have a choice. You can do this. Like, it doesn't impact my life at all, but you might find a different way that works even better for you potentially in the long run. So
Yeah. And I appreciate you giving me the options because like you gave me the space to decide for myself. I was really scared. And I'll be honest, I had a hard time sleeping that night. I was really freaked out. For me, all I ever knew my whole life is you're sick, you go to a medical doctor, they give you medication. That's how I lived my whole life up to that point. So I literally didn't even know there was another way. So you were introducing something to me that was just completely foreign. I didn't know I had a choice. I didn't know this option was there for me. And so I was so afraid that if I took the supplements, if it did and they didn't work, then the infection that I had, which was so severe, would just keep progressing over those days, however many days I was taking the supplement. So that was what I was wrestling with was if I do this, then I'm just going to watch it get worse. And I could have just,
I'm going to die. And then if I don't die, my mom's going to kill me.
yeah, because I mean, that's what my mom would do. Yeah, I would cough, I was sick, whatever. I'd go to the doctor. I had a bunch of ear infections growing up and things like that. And it was go to the doctor and get medication. And that's largely how millions and millions of people, that's how they operate to this day. So it's not like it's unheard of, but so I slept on it and I thought about it. And the next day I decided to take the chance and I was so scared. And you said, here's what you need to take and when and how many. You told me all that. And I took them for 10 days and I went back to my medical doctor to get tested to see if the infection was gone. And it was. And that was definitely a life-changing moment for me.
And I remember, I remember this vividly because it was kind of the look on your face actually is what the thing that I remember the most, where I guess he came in, he says, no, the infection's gone, the antibiotics worked. And you were like, didn't take the antibiotics. And he was like,
yes,
that's impossible. And you were like,
yes,
and so I remember you looking just stunned, surprised, confused, all of these things. And I was like, well, yeah, why wouldn't it be? So just the two different perspectives of, well, yeah, you give it the right nutrients, your body is designed to be healthy. Homeostasis, is the point of regulation. The body is always trying to stay regulated. It's like a thermostat, right? You have your thermostat set. If it gets too cold, it comes on and heats it up. If it's too hot, it cools it down. Your whole body is basically regulated in that way where it wants to maintain a balance. So, it'll create whatever biochemicals it needs to, in general, to fight things off. I mean, there's a time and place for surgery. There's a time and place for pharmaceuticals. I'm not saying go outside and rub some dirt on it and you'll be fine. Like there's definitely limitations to all matters. So you let something go far enough, yeah, you're going to have to manage this. And it depends on how you choose to manage it. But there's lots of options generally at the beginning for most things.
I completely agree. And obviously for me, I was a convert from that moment on. And I have to say, there's a power in taking back your own health and putting it in your own hands. I didn't feel powerless. I didn't feel like I was at the mercy of medical doctors and, medication if something was wrong with me from that time on. And I'm such an advocate for this. And I tell anybody and everybody, I've done tons of research over the years. Anytime something's wrong with me or somebody in my family, I'm like, I know there's a natural way to handle this. There has to be. And 9 times out of 10, there is. So I got better from that. And then also when I was living with you, I got an abnormal pap smear. They said I had precancerous cells on my cervix. And I came to you immediately. And I said, Jen, this is what they told me. And I was really scared because at that age to have an abnormal pap, you're just thinking, oh my God, do I have cancer? Right. They're saying precancerous, which makes you think just a matter of time before it blows up into cancer. Right. That's where your head goes. And so I talked to you and you said, okay, we're going to put you on vitamin A and D and vitamin E.
And it was therapeutic doses. It wasn't just like, oh, I'm taking, 100 IU of something. Like we gave you therapeutic doses.
Yes. Yeah. Thank you for clarifying that. So I went to my gynecologist. All I said, and it was a little bit of a fight, was I think I said, handle this on my own. Or so I was really general with what I said. And I want to come back in a month and have another pap done, basically check and see what the cells are doing. So I did that for 2 months. So I had the first pap was abnormal. the second one, and they gave me a diagnosis of ascus. And for any woman who's listening, atypical squamous cells of unknown significance. It's kind of a bucket diagnosis. All they know is there's abnormal cells. And so they just kind of throw everything into that bucket as a general diagnosis. So all it means is something's wrong. It's not specific. So the first month, the number of cells lessened, number of abnormal cells. The second month, they said it was just a minor irritation. And I'll never forget, they said, this could be due to laundry detergent.
Yeah, because, we get laundry detergent all the time, all the way up our vagina and irritating the crap out of our cervix. So, yeah.
I'll never forget that because it was so ridiculous. And so my next pap was clear, was good. It was normal. And they've been normal ever since. For the rest of my life, they've been normal. So that was yet another mind-blowing moment and just further reinforcing the path I was already on. But the other thing that happened was when we weren't living together anymore, I was having really bad, like horrible kind of PMS mood swings, and they were lasting the entire month. And I wasn't even somebody that had mood swings. I would get a little bit irritated, more irritated than normal before my period. Like I'd feel it coming on. I would just get quiet. Like with my husband, I'd be like, hey, I'm just not going to talk to you as much right now. I just need to be quiet because I can feel like I'm really irritated right now and I don't want to take it out on you. But I came to you and I said, I don't know what's going on, but this has been happening for 2 months. And it's just like I have PMS all month.
Let me interrupt too, because I think the time frame between the initial, the UTI or whatever you want to call it, and then the atypical cervical cells, I believe that the hormone stuff was probably 5 to 10 years probably after that is my guess.
That's about right.
Well, I just for timeline reasoning, that's why I was like, it was years later.
Yeah, we weren't living together. No. This was probably in, I would say, 2006 or 2007, somewhere in there. So I went to you. First, I went to my doctor because I remember I would see you once a month. And if I had something wrong, I'd like to go to my doctor first to see what she would say. I like to test her. So I'd go, here's what's wrong. And sure enough, she'd go, oh, here's a prescription. And then I'd go to you and I'd say, here are my symptoms. And then you'd figure it out and give me a supplement and then I'd be okay. Well, I did this a lot. So with this, I love doing this test. It was always fun. So with this one, I went to my doctor.
You need a more exciting life.
Well, because this, I still was like, this is kind of fun to go to the medical doctor and be like, what do you think it is? Because I knew you'd figure it out and fix it naturally because you always did. Like you always have. So for me, I just thought, oh, this is kind of a fun exercise to do. So I went to see her. I told her, I'm having PMS symptoms all month long. I feel like I'm losing my mind. Like it's really bad. And she said, well, you're probably just having some severe mood altering PMS symptoms that are lingering beyond your period. Here's a prescription for Serafem, which is an antidepressant. I walked out of the building. I tore up the prescription and threw it in the trash right outside the building. Didn't even get in the car. I just
Let me ask you, did she do any labs leading up to that? Or how did she come up with the diagnosis of PMDD or whatever it was?
Oh, no, she did not do any labs. This was a conversation. That's all. I just told her what my symptoms were and she wrote the script. So yeah, nothing to check anything that was happening in my system. So I went to you. I described the same symptoms that I did to her. I said the exact same thing. And you said, your pituitary gland is angry at you.
So, okay, for any of the listeners, I generally do not give a diagnosis. So if you have a sinus infection, I'm not going to say, oh, you have a sinus infection. I'm going to say, okay, your sinuses are having issues and we're going to do this. And, we just go from there. So I tend to find that there's a lot of people who hold on to diagnoses. So it's not something that they're experiencing. It's almost like who they are. So when people go, oh, cancer patient, I'm like, no, it's a patient with cancer. Like you're bigger than your issues. And so when I said, okay, your pituitary is angry with you, and honestly, without any kind of blood tests and stuff like that, it's an easier way to manage things. But there's also certain ways that you can diagnose different types of, I don't know how to explain it exactly, but like if somebody comes in and they have acne on their face versus on their back, then I know whether it's coming from the anterior pituitary or the posterior pituitary, and there also can be a gut involvement because the skin will tell the story of what's happening in the gut. But that being said, your pituitary is angry. Yes, obviously if I sent this into an insurance company, I would have to come up with, an ICD-10 code and give something more than that. But at the end of the day, I'm not dealing with any of that. So I just tell you that this is what's happening. Looks like where the issue is coming from. And then let's start here.
And I remember when you said that, what it was, I remember thinking, oh, wow. I just, I would never have known that. It would never occur to me. I don't know enough about the body to know that's what was going on. So you prescribed a supplement, pituitrophin, and you said I remember I had to take 4 a day, and you said, in a week, I'm going to check you and just see, how you're doing. And so I basically, over the course of a month, I stepped down how many I was taking until I didn't need it anymore. But I vividly remember on the second day of taking it, I felt like myself again. All the symptoms were gone. And I could not believe it. I just couldn't believe it. I was like, this is incredible. So yeah, that was huge for me because I really did think I was losing my mind. What I was dealing with mentally, it was just too much. And so once again, I was astonished by what you did. And for me, this has been, the last 26 years, I have not taken any medication. And I've had health issues. Don't get me wrong. I've had health issues. Obviously you treated me. So I've been your patient for so long now, but everything was treated with alternative medicine, with supplements. And I'm a very healthy person. And when something goes wrong, it doesn't really take that long, frankly, to course correct. And
But also that's you though too, because what happens is you don't wait. I had a patient that came in and they'd gotten sick recently and it turned into walking pneumonia for sure. And they had it for 3 weeks before they decided to do anything about it. And I'm like, that's not what you want to do. So, when you pay attention to your body, there's a difference in being aware of your body and being a hypochondriac, but at the end of the day, like if you're feeling something and you know that something is off, just managing it immediately and finding someone who's going to help you and actually listen to you. Because I listen to my patients way more than I think the average physician does because they live in their bodies. They know when something is off just a little bit. So I'm not going to be like, well, I don't know. I'll just see how this goes. Like I'm not going to do that because I wouldn't want to be taken care of that way. I wouldn't want to go in and have somebody just be like, oh, okay, it's probably in your head. Here's an antidepressant for something that's going on with you hormonally. I have plenty of people that come in with thyroid issues and their thyroid labs of TSH and not any of the other 8 or 9, labs are being done and they're being told that their thyroid's fine because their TSH is fine. I'm like, no. This is like a puzzle piece. You need lots of pieces to put that puzzle together appropriately because there may be these little nuances and we're going to get into that too. We're going to get into labs so that you can read your own labs and know what they mean and not wait until the numbers get into a range where you have to treat a condition. I always say I want to turn the Titanic around before it hits the iceberg. Like I don't want to clean up a mess. Neither do you. So let's look at some of the possible issues that are happening right now and flip that around before we have a huge mess to clean up.
Absolutely. No, 100%. And I'm definitely someone, and you've said this to me many times over the years, I'm really in tune with my body. So I reach out whenever there's something wrong. I'm like, I feel like this or like that. These are the symptoms. This is what's happening. And again, you just always figure it out. Like you're magical. I don't know how to explain it. I can't even tell you how many people I have told about and talked about you too. It's in the several.
And I really don't think it's just me. I think there's plenty of physicians out there that are willing to listen to their patients and dig a little deeper. And I always tell my patients, you're going to give up before I do, and we'll have some of those patients on this podcast because they said that they'd be willing to talk about stuff that went on with them. And this by no means is about look how amazing I am. That has nothing to do with that. It has everything to do with I'm just a conduit. I have information. I'm, very educated. I'm very well educated, but I also educate myself. I read medical research every single day. I go to PubMed. I find papers, and you can do that too. I mean, any of the listeners can go to PubMed and go look for certain things. For example, like the HPV vaccine,
Mhm.
talk about it causing potentially infertility, and you can't look up infertility and HPV vaccine. You have to look up ovarian failure and HPV because it won't come up with the word infertility. So there's certain things that, I'm going to go through these podcasts with you and give little bits of information. I'm never going to tell a single person what they should do with their health or their life. I don't have your lab sitting in front of me. I don't have you sitting in front of me. I'm not going to do that. But what I do want to do is give enough information that it can start giving somebody a path where they don't have to feel like they're sitting there on the ground waiting for someone to come save them when really they need to get up, you know, wipe their knees off, get the dirt off, shake it off, and you start helping, like, figure it out for yourself, becoming a little bit more empowered. So we're going to go through that. And I have plenty of patients, like I said, who have not given up when they've been given certain answers. And it's pretty cool to see. So like I said, this has nothing to do with me. It has everything to do with giving everybody just a little bit more information, like realistic information, not, okay, throw away all your pots and pans, which of course, like, no, I'm not going to be like disagree with some of that depending on what you're cooking with. But, it's not a total overhaul where I'm going to say, okay, you have to get rid of this. Don't do this. Like, this is real life. So giving ideas and little tidbits of information along the way of, okay, let's look at your labs. Let's talk about that. Let's see what you can do. And that might help you move in one direction versus another direction. Just because your neighbor says, oh, this worked for me doesn't mean it's going to work for you. I'm also, when patients come in and their diets are terrible, I always ask them, what is the easiest thing that you can get out of your diet? And they always look at me like, oh, I mean, I guess it's this. I'm like, is that the easiest thing? And they're like, no, that would be the hardest. I'm like, no, we're taking the easiest thing. We're going to start that. This is not a crash diet. This is a lifestyle change. So let's do that. And in 4 or 5 months, if you don't have a craving for that anymore, then add something else. If you can do it before that, then great. And that's the one thing I don't ever chastise my patients. I don't yell at them. I don't be like, oh my gosh, I can't believe you didn't do this or follow my directions. This has nothing to do with me. This has nothing to do with my ego. This has everything to do with giving information, realistic information for people to actually do something with it. So, and without judgment. I mean, I have plenty of patients that come in, and I have one couple, they came in and they were literally going to McDonald's and getting a sundae every single day. And she was morbidly obese and older and in tons and tons of pain. And we all know, I mean, we should at this point, that sugar is very, very pro-inflammatory. Unfortunately, I worked with them and we could not get them to not do the sundaes. She lost 6 pounds in 3 days by not eating sugar for 3 days.
Wow.
And, the goal was 10 pounds in 2 weeks just by eliminating sugar out of your diet. And that's processed sugar. That's not the bagels that were being eaten for breakfast and stuff like that. Everybody's a little bit different. And I never once said, oh, I cannot believe you can't do this. Like, we're all in our own space. We're all in our own place. We're all doing the best job we can. I mean, nobody goes into this and goes, can't wait to mess everything up. I tell my patients, I'm like, if you walked across the street and you fell in that crosswalk, you wouldn't just lay there and wait to get run over by everybody driving by. Like, get yourself up, get yourself to the other side of the street, reevaluate everything and see what you can do. Don't just lay there and be a victim. Figure it out. And even the littlest steps, the littlest things that people can do eventually make a huge, huge difference in their health and, their mental health, their physical health, everything.
No, I love that. And that's so true. And I think for me, what I want people to know is it's scary to take a chance and let your body heal itself by giving it the right nutrition, the right tools, the right supplements, whatever it is. It's scary, but it's so worth it. I mean, it changed my life. And I'm a really healthy person. My kidneys and liver haven't been processing medications for the past 26 years. They haven't had to process anything like that. And so I'm an organ donor, not to get off on that, but I joke around that I'm an organ donor. I've been an organ donor since I was 16 years old. And I always say to people, when it's my time to go, my organs are showroom new. They're in such good shape. Like, they're so squeaky clean, ready to go. So
they're going to live till they're like 120, with that liver.
They're going to be like, I didn't even want to be on earth this long. Jeez, this lady's liver. Oh my God. Yeah. No, I think the biggest thing is just letting people just have faith in yourself, have faith in your body. It is an amazing machine. So if you just give it the right tools, it will take care of itself. And I think that's just such a beautiful thing. So I'm super excited on this podcast to hear about other patient stories. I love learning about other people's journeys and how they got to wherever they were and when did they turn the corner and realize that they had other options. I don't know. I'm fascinated by that. I love other people's stories. They light me up. So,
Well,
yeah.
and we're gonna do that. We'll go over and introduce people every week, as well as discuss labs and go over each line item. And then we will be doing podcasts where we do like a live Q&A. And I mean, there's so many fun things that we're going to end up doing with this. So there's so much in this noggin of mine that I want to share. And I know that a lot of it's out there with social media, but there's more to it than that. And everything that we talk about will be able to be researched and looked at. And like I said, PubMed is going to be a great place for you to start looking for things. It's not the end all be all, but it is a good place to start looking for things and question everything. Question me, question your medical doctor, question anything. If it doesn't feel right intuitively to you, it's probably not. There will be answers and they'll pop up in the least expected places sometimes.
Yeah, absolutely. And we have a whole community that we're building in school. We have a website, speakingholistically.com. I'll put the information in the show notes. We're obviously building all this out. It's new, but super excited. I've said from the very beginning when we started, rolling around this idea and talking about it, the whole purpose of this is to turn your head and shake out all the knowledge you have in there as much as we can get from what's between your ears. Because, I know a lot of doctors, a lot of chiropractors, a lot of people, that once they go through and get their education, a lot of them will kind of stop there. And you are one of those people who you have gone on to continue educating yourself to like an insane degree. And I'm so impressed by it. And I think it makes you just so much more knowledgeable because you stay up on everything. And I think that's just incredible.
Well, and that one thing too, that when you said that, it kind of hit me. I did a conference. I attended a conference. I didn't put it on. I have a lot of kids and I have a lot of stuff going on in a private practice and a telehealth practice and stuff like that. So, but one thing that really kind of hit me too was I went to Chicago for a 3-day conference on the MTHFR gene, which I had been reading about and finding as much as I could at the very beginning. Probably 20 years ago, there was no information on it. MTHFR is methyl tetrahydrofolate reductase. That's why it's called the mother effer gene, because it really messes with you. So it's dealing with methylation.
Thank God there's an abbreviation for this.
I know, right? So, and some people actually wear t-shirts that say, I'm a mother effer, MTHFR or whatever. So what's your superpower or whatever? So no, but I spent 3 days inside a hotel conference room with about 500, most of them were medical doctors. And when the woman came out that was putting it on, she said, how many of you have heard of MTHFR? And only half the room had raised their hand. And I thought, oh, well, this is going to be easy because I've been reading about this and looking into it. And especially even finding that there was an issue 20 years ago, and not really understanding why somebody needed a methylated form of folate instead of folic acid. Like somebody could go to CVS and get the folic acid, and other people, they couldn't do that. When she asked how many of you deal with it on a regular basis, only 10 of us raised our hands. And I thought, oh
my God,
next 3 days are going to be amazing. It's going to be easy. So it's such a breeze, but literally 3 days on that one gene, 3 days. And so I'll have patients come in and like, do you know anything about this? I'm like, oh yeah. And they'll tell me their medical doctor is telling them, oh, it's just about blood clotting. And I was like, no, if it was just about blood clotting, I wouldn't have spent 3 days on that one gene in a conference room with some of the most hopefully educated people on the planet, because they were at least attending this conference instead of reading a conclusion on some PubMed article. You know what I mean? So anyway, there's more out there than that. So if you're given some simplistic answer, just make sure you're continuing to look and dig and don't give up, because there are answers out there for literally everything.
Yeah. Advocate for yourself, speak up, ask questions, know your rights, all of those things, because you have options, you have other options.
Well, and if you don't know anything, you don't have any options. So being educated is super, super important. I used to teach childbirth classes, and I would give them all the information. I was like, this is how this is going to work. This is how this is going to go. If you make this decision, these are your options, And if you don't know those options, you don't have any. So yeah, it's important.
Yeah, absolutely. Well, I have thoroughly enjoyed this. I could
Me
talk to
too.
you. I could talk to you forever. You know this. You're one of my favorite people. You're one of my favorite.
Because this is the first of many, so get used to it.
I feel honestly, it's such a privilege to do this with you. I think you're incredible. And I just want to get that knowledge out of your head, get it out into the world because you know so much. And for a lot of people, taking their health in their own hands is scary and they don't have answers. They don't know where to start. And I think even a lot of people are going to be able to relate to other patients' journeys when they come on to the come on the podcast and talk about their experiences and what it was like for them and whatever their ailment was. There's going to be listeners that are like, oh, I have that. Oh, I didn't know that could be treated this way. So it's going to be really great to just, there's going to be light bulbs going off in people's heads when they listen. And I'm super excited about that. So this first episode was just really get to know us, how we met, and then personally how my journey looked for me. And hopefully you found it interesting. And we're going to wrap up and we'll talk to you next time. Thanks, everybody.
Perfect. Thanks.
That wraps up another episode of Speaking Holistically. Thank you for listening. We hope today's conversation gave you new insights and inspiration to take charge of your health. If you enjoyed this episode and want to hear more, be sure and join the Speaking Holistically school community by clicking the link in the show notes. There, you'll get access to daily podcast episodes, weekly live Q&As, educational content, and so much more. You can also connect with us on our Facebook page, follow us on Instagram, and subscribe to our YouTube channel. Until next time, be well, stay curious, and keep speaking holistically.